and you told the Washington Post that your plan to replace Obamacare will include insurance for everybody. That sounds an awful lot like universal coverage.
It's going to be, what my plan is that I want to take care of everybody. I'm not going to leave the lower 20% that can't afford insurance. Just so you understand, people talk about Obamacare. And I told the Republicans this. The best thing we could do is nothing for 2 years, let it explode, and then we'll go.
Let me just ask you while we're standing outside, could you hear the voices from the Women's March here in Washington? We know there were more than 1 million people who turned out, and you are their president now too.
It's true.
Could you hear them from the White House?
Are you still awake out there? Are you sure about that? Can you hear me? Are you ready to shake up the world? Welcome to the revolution of love.
The ayes are 217, the nays are 213. The bill is passed, and without objection, the motion to reconsider is laid upon the table.
CNN reports protesters outside of Senator Ted Cruz's office laid on the ground before being carried away by police. Nurses were also protesting, saying the bill would hurt their patients. The Washington Examiner reports one nurse called the bill, quote, a death sentence for patients.
The skinny repeal appears to be a sort of last-ditch backup plan. This is definitely McConnell giving it the old college try. He's worked really hard to try to write a bill that he thought he could get to 50 votes. He's really struggled with that, and I think now he's potentially trying again.
Okay, the committee will come to order. I'd like to welcome everyone to this afternoon's hearing, where we will discuss and examine the Graham-Cassidy-Johnson-Heller health care proposal. If the police would please remove that person, we'd appreciate it. And keep the doors shut.
Guaranteed protection for those with pre-existing conditions will be gone. The bill sponsors will tell you otherwise, but colleagues, the facts are the facts.
The persistence and prominence of registered nurses in this fight is a huge factor as to why we are where we are today. And when nurses organize for guaranteed health care, they don't start with how do you pay for it. They start with how do you guarantee the health care that our patients need and establish a universal standard of excellent care.
Roseanne tomorrow with the CNA and in you. Nurses! Healthy California. I mean, come on. You guys know you're changing the world, right? I don't need to say that. You know, I always say heroes aren't made, they're cornered.
Everybody in, nobody out.
It is an amazing moment. Think of where we are. There was this person who ran for president last year who said that single payer would never ever happen. And yet, 17 senators are supporting Medicare for all.
We want health care without financial obstacles and barriers to care so that people get the health care they need and the family financial stability that they deserve. And the only way that New York can do that is by enacting the New York Health Act for a universal, improved Medicare for all. We need to fight back, and the best way to fight back is to show what we're for so that New York can help take the lead and eventually lead the whole country. Thank you.
Hey, brother.
Good morning, this is Carlos with the Bernie Sanders Brigade. We're here at the State Building in downtown Los Angeles, where, as you can see, the nurses and supporters of SB 562 are already gathering here for a rally.
So we have one of the big advocates for the bill here. For those that don't know you, can you please introduce yourself?
Sure, I'm Bill Honigman, Dr. Bill. I'm an ER doctor. We need to be here in support of having a Medicare-for-all type system for California.
We are here to bring SB 562 to the hearings. We've been excluded. An actual Democratic bill that was passed by a Democratic state Senate has been excluded from the hearings. And we're here to say, as supporters, as advocates, that we need single payer right now.
We can provide care for all of our people like they do in Canada, and even more with things like mental health, dental, vision, long-term care, detox and rehab.
It's amazing how fast the technology allows us to do this. 30 minutes ago, I had no idea this was happening, and then we just all came out. And this is what we need to do across the country. We have to show the government that we're going to stand up.